Welcome to Thursday's edition of COVID-19. Authorities are on high alert as new infections have hit well above 500 today. Meanwhile, on a slightly bright note, vaccinations of the broader public have been launched, and we have more on those efforts later on in the program. We start now with the pandemic updates with our Kwon So-ah. Now, So we are marking a second day of cases in the 500s here in Korea today.
We are, Sunny. We are seeing an uptick by 45 infections compared to a day before, with 551 cases confirmed as of 12 a.m. this Thursday. And that also marks an increase in domestic transmissions, while the number of imported cases remains almost unchanged. Now, with that, Korea has a total of 103,639 infections, and with 4 additional fatalities, the death toll at 1,735. If we now take a look at our graph, we see 3 days in total in the past week where the numbers have hit above 500, so that is raising concerns. And especially here in the capital, Seoul, the number of daily cases stands at almost 200 this Thursday, which is the highest figure in 1.5 months. Also 130 in Gyeonggi province. Almost the entire country is seeing cases this Thursday, and especially a concern down in Busan, which again has over 50 infections. And due to the surge in the country's second largest city, Busan, social distancing measures there are expected to be raised to level 2, just like in the metropolitan region. And other municipalities are also mulling an upgrade.
Right. And on a more positive note, though, vaccinations are underway for the greater public, as I mentioned earlier.
Right, Sunny. As you said, vaccinations for the broader general public has begun with the beginning of the month, and that includes seniors aged 75 and above who are being administered with the Pfizer vaccine since this morning. Now, there's also some good news regarding that Pfizer vaccine, as Pfizer-BioNTech's push is to have their vaccines approved for adolescents, first expected in the US and Europe. And it showed 100% efficacy in a phase 3 trial in 12 to 15-year-olds with no significant side effects. So that eventually will also be a positive development here in Korea, which is currently administering Pfizer and AstraZeneca vaccines. Now, speaking of AstraZeneca, in a recent analysis, it was shown that 86% of effectiveness was seen after just a first dose of the vaccine here in Korea. And here we are seeing the number of people who have already received their first shot, and here almost 13,000 who have also received their second shot of vaccination. Meanwhile, Prime Minister Chung Se-kyun this Thursday hinted at the introduction of a vaccine passport or green card, which should help people to get back to their normal lives after vaccination. Let's take a listen.
Following preparation since early this year, the government has completed developing a system that provides proof of vaccinations on smartphones. Blockchain technology will be utilized to block identity theft, while personal information will not be stored to begin with.
Those vaccine passports should eventually help us travel around the world, as many other countries are also considering the introduction of such. Let's take a look at the figures now abroad. We have the US with 31.1 million infections, and France with 4.6 million cases has now gone into another lockdown, and an extended lockdown, I should say. Meanwhile, Peru has surpassed South Africa in total number of infections. Let's get into the details of daily increases. Here, France, almost 60,000 cases in just a day. That's not a big difference from the US, but here Brazil has the highest number of daily infections at almost 90,000. And we're also seeing an increase in the global figure here, which was at around the 500,000 and now at 673,000 this Thursday. The death toll is also increasing as we are approaching the end of the week. And those are the updates I have for now, but I'll be back in a bit after the government briefing. Sunny?
All right, so thank you for that. Right, as we mentioned earlier, as of this Thursday, vaccines are available to the greater general public here in the country, and the so-called vaccine holiday initiative is also underway to allow those inoculated a day or two of rest to address their post-inoculation discomforts. Now, for more on this, I have our Kim Dami here in the studio. Welcome, Dami.
Good afternoon, Sunny.
Right now, I hear the KDCA Commissioner Chung Eun-kyung also got her shot this Thursday morning.
That's right. So nation's top health official Chung Eun-kyung got her first vaccine dose earlier this morning. Like other vaccine recipients, she had to visit one of the dozens of vaccination clinics that are operating nationwide. Commissioner Chung got the AstraZeneca jab, the same vaccine administered to President Moon Jae-in and Prime Minister Chung Se-kyun. And after getting the shot, she also waited at the clinic to monitor any side effects from the vaccine before she was cleared to leave.
I see. Now, Tammy, tell us more about the vaccinations here in the country for the elderly.
Sure, Sunny. So starting this Thursday, people aged 75 and above can now be vaccinated here in the country. That will apply to over 3.5 million people. And a survey shows that as of last Sunday, around 86% of people in that age group are willing to get the shots. And because the Pfizer vaccines have to be stored at minus 70 degrees Celsius, those eligible to get their shots must visit a designated vaccination center that is equipped with ultra-low temperature freezers. There will be a total of 49 vaccination centers across the country, and Pfizer vaccines for 6 million people will gradually arrive here in the country over the next 3 months. Also, starting in April, local firms are being encouraged to give their employees a leave of absence in case of any side effects after they're vaccinated.
접종 다음 날
We will do our best to give people a day off following their inoculations. For those with prolonged side effects, their leaves can be extended to 2 days.
The government is also seeking employers to shoulder the burden by providing paid leave to workers who get vaccinated. The new measures are not legally mandated, but they are strongly encouraged, with the government seeking cooperation from the public to ensure a safe rollout of vaccines.
Meanwhile, Tammy, as part of efforts to better protect children from COVID-19, I hear all workers at daycare centers will be required to get tested for COVID-19. It's at least once a month.
That's right. So also starting in April, all daycare center instructors must get tested once a month amid the growing number of infections among small children. That will apply to over 300,000 people. And after getting tested, they will have to wait at home until the results come out. And also in April, the government will start vaccinating school teachers, beginning with those at school for the disabled on the 8th. They'll be getting the AstraZeneca shots. So in all, health authorities are looking to vaccinate 284,000 education workers within the second quarter. They will also be eligible to take a leave of absence after getting their vaccine.
One final question, Tammy, before you go. I understand Korea has no plans to add Russia's vaccine to its portfolio. Could you tell us a bit more about this?
Right, so there have been rumors that the government is seeking an approval of Russia's Sputnik V for the use here in the country, but Korea's Ministry of Food and Drug Safety announced Wednesday that there is no such plan, contrary to speculation. So this comes amid foreign media reports citing the Russian embassy in Seoul, saying that Korea was seriously considering the adoption of Russian vaccines.
I see. All right, Tammy, as always, thank you very much for that coverage.
My pleasure.
Right, it's a little after 2 and we are poised to join the regular briefing on the COVID-19 situation here on the local front for this Thursday. Now, the authorities have launched their second quarter vaccinations, which target the greater public, including the elderly. Now, 46 public vaccination centers across the country are open to offer the first dose of the COVID-19 vaccine to those who are hoping to be inoculated. And while we wait for the briefing to start, let's take a look at Korea's social distancing guidelines in place until the 11th of April. The Greater Seoul area faces level 2 social distancing guidelines, while most other regions of the country are under level 1.5. The ban on gatherings remains in place, with 5 or more people not permitted to meet for social purposes. An exception has been granted to immediate family members, including grandparents, parents and children, with a cap of 8 people in total. Now, the same goes for the formal pre-wedding meeting involving couples and their parents, as well as for a child's first birthday party. A few businesses, including movie theaters, internet cafes, video game arcades, cram schools and amusement parks, as well as retail stores, face no limit on operation hours. Meanwhile, restaurants, cafes, indoor gyms, singing rooms, party venues and indoor standing concert places can be open until 10 p.m. here in the metropolitan region, while those elsewhere nationwide face no time restriction. And the same applies to nightlife entertainment establishments, including bars. Also, movie theatres and performance halls are being asked to leave one seat empty between patrons or parties. Sports stadiums here in the Greater Seoul area can host 10% of their capacity, while those elsewhere can host 30%. The attendance cap on weddings and funerals stands at 99 here in the metropolitan region and 499 in the rest of the nation. Places of worship are to abide by a 20% capacity here in the metropolitan region for regular sermons and a 30% capacity elsewhere. Other religious activities such as Bible study, choir practice, meal sharing and lodging remain banned nationwide. We are still waiting for the briefing to start, so perhaps we can also take a look at today's... No, we will not do that because the briefing is about to start. We'll come back to you afterwards.
First of all, here is Mr. Kwon Junuk with the explanation on the briefing.
Let us now begin our regular briefing on the COVID-19 situation here in South Korea for April 1st, Thursday. As of today midnight, we have 537 new local infections and 14 new imported cases. The total caseload now stands at 103,639. And a total of 71,499 tests were conducted yesterday. And at the makeshift testing centers in the metropolitan area, we carried out 31,996 tests, confirming 81 confirmed cases. And we also have 409 more people being discharged, while 6,465 still remain in quarantine. And we have 107 patients with critical or severe conditions, and we had 4 additional fatalities. I extend my deepest condolences to the deceased and the members of the bereaved families. And here are the recent major local clusters by region. First of all, in the metropolitan area, we have 63.7% of the total cases today. And aside from Gyeongbuk province, all of the area's provinces, we have seen an on-week increase of the daily tally. First of all, in the metropolitan area, in Seoul's Dobong-gu district, in relation to a hospital, we have an accumulated number of 12 confirmed cases. And in relation to a high school in Songpa-gu district, 11 cases. And in Seocho-gu district, in relation to a telemarketing firm, 23 have been confirmed. And in Gyeonggi-do province, Goryang City, in relation to a family, we have 14 confirmed cases to date. And next, moving on to Chungcheong provinces, in Sejong City, in relation to a primary school, 21 cases have been confirmed. And Chungnam Dangjin City, in relation to a family, we have 7 confirmed cases. And Chungcheongbuk-do province, Boongun County, we have the Research Institute with 10 total cases to date. And in Honam region, in Jeollabuk-do province, Jeonju City, in relation to a gathering of high school students, we have 7 people. And also Imsil City, we also have clusters there as related to the family gatherings, and also 13 additional people for the public bathhouse. And also in Daegu, in relation to a place of business, we have 31 total confirmed cases. And Busan, in relation to a singing pub, the total now stands at 136. And also in Busan Yeonjae-gu district, in relation to an elderly welfare center, we have 51 cases. And also Yeongdo-gu district, we have also 14 cases in relation to church. And Dongdae-gu district, 18 confirmed cases in relation to a place of business. And next, for the past month, we have seen at the nursing hospitals and long-term care centers, which carried out the preemptive testings. And here are some analyses that we have found. And the quarantine authorities have carried out recently, starting from the 26th of February and until the past month, we have carried out preemptive testings for virus vulnerable facilities. We have also carried out a total of 2.5 million tests, and among them at nursing hospitals and long-term care centers, as well as mental disease centers, as well as homeless shelters. At about 34 facilities, we identified 31 confirmed cases. The quarantine authorities would like to note that in relation to certain provinces and regions that are prone to virus infections, we will be carrying out massive testings as well. And also we have our new soldiers, trainees, and we will also carry out our massive testings for them. And we also will be carrying out the testings for the correctional facilities as well. And we have carried out these massive testings, and we have also found a total of 52 people who have tested positive from these new military trainees, as well as people in the correctional facilities. Please note that these preemptive and massive testings have been carried out starting from February 26th until the March 25th, and we have been carrying out these tests for about 530,000 people, and we identified about 490 confirmed cases to date. And as for the correctional facilities, we have carried out these similar preemptive testings starting from mid-March, and we have been extending these scope as well to include the juvenile systems, the juvenile facilities as well. And moreover, starting from April, we will also carry out our monthly preemptive testings for daycare workers as well. And we have a resurgence of the virus, and this is why we are taking full caution, and we will make sure that we have no blind spots of infection, and we will be expanding the scope of these preemptive testings in order to prevent further spread of the virus in a locally. And also we have some updates on our R&D measures, and in relation to our treatment injection, we have also the Becqueroli, which is the remdesivir. We have also administered the drug to over 5,600 patients here in South Korea, and the Recunora treatment has been also administered to about 920 patients here in South Korea. Moreover, on a daily basis, we are carrying out experts panel meetings, and we have the meeting carried out, and in this meeting we will be discussing the self-diagnostic test kits and the rollout of such test kits going forward in order to prepare ourselves for the prolonged COVID-19 and another major resurgence of the COVID-19 virus here in the South Korea. And we are also monitoring global situations, and also we are carrying out multifaceted discussions with our panel of experts. And we also have some live quarantine measures. First of all, in our Safety E report, we have some reports of the breaches of the quarantine measures. Lately, we have some reports of the direct sales and door-to-door sales businesses which did not comply with the quarantine measures. In particular, they also said they also had daily meetings of hundreds of elderly citizens at confined places, and they also carried out promotional services, and they also had group meals engaging more than 5 people. And as for the related promotional facilities, we would like to note that these are also prone to 3C environment, which means confined, crowded, and close contact environment, which raises significantly the risks of infection. So we ask the workers and the managers there to designate a manager in charge of quarantine measures, and also check the temperature for all of the people coming in to these facilities, and also prohibit anyone who are showing clinical symptoms of COVID-19, and they also need to have a strict entry log as well. Moreover, all of the users need to wear their face mask at all times, and they also need to minimize unnecessary physical contact with other people, and also comply with the quarantine measures. This is essential. And next, we have some status on the COVID-19 vaccination here in the country. As of April 1st midnight, we have 22,643 more people being administered with the first dose of COVID-19 vaccine, with the total standing at 876,573. And we also have additional numbers of the second dose recipients, and a total of 12,973 is the total number for the second dose recipients. And we also have the vaccination rate standing at about 83.5% for our first dose COVID-19, and by facilities, 87% at nursing hospitals and care facilities, about 90%, and the first course responders, we have about 79%, and general hospitals, we have 81.3%, which have completed the first dose of COVID-19 vaccination. And at COVID-19 hospitals, we are carrying out second dose of the vaccinations, and a total of more than 60,000 have been administered with their inoculation so far. Moreover, in Q2, the vaccination rate stands at 37.6%. And here are updates on post-inoculation adverse responses. We have 123 new cases, with a total now standing at 10,698. And among them, most of these symptoms were mild and common symptoms that were common after inoculation. We had 2 additional cases of suspected cases of severe cases, and also 2 additional cases of death, and we are under investigation as of now. And last but not least, I would like to note the following. Recently here in South Korea and globally as well, we are seeing a trend of the COVID-19 resurgence, and also centering around Europe. Despite the high rate of inoculation, we are seeing a major resurgence of the virus due to early ease of social distancing measures, as well as the emergence of new variants that are known to be more transmissible. And the same goes for South Korea as well. During this year, we have seen a daily tally of between 300 and 400. However, today, our daily tally has jumped to 537 local infections today. We are seeing a decline in the number of fatalities. However, we are also seeing a very grim reality right here in the country. Right now, nationwide, we are seeing cluster infections sporadically. This is why our health authorities cannot ease our complacency. Moreover, nationwide, we have some cluster infections, and also we do not have a designated region or specific clusters that are leading to a major resurgence of the virus. And even at the major facilities that have seen cluster infections in the past, we are seeing a repeated pattern. This means that our local community has a wide spread of the local transmissions of the COVID-19, and this is continuously spreading nationwide. Moreover, we also have the risk factors coming in from the influx of new variants and the spread of new variants. This is not only more transmissible, but also is more deadly, and this can also decrease the effectiveness of our vaccines as well. And aside from the new variants that we already know of, there are also other new variants which have been identified in the US. We are carrying out our inoculation campaigns. However, after inoculation, we will peak our immunity development only after 3 to 4 weeks after inoculations. This is why we cannot highlight more the following measures of quarantine measures, of abiding by these quarantine measures. That is, primarily we need to also protect the senior citizens. We will be providing the inoculations for these groups, and until then, and until we have a large immunity of these people, we need to wear our face mask and also keep social distancing measures. The quarantine authorities will carry out full-fledged inoculation. We will be intensifying our social distancing measures based on freedom and responsibility, and we will also exert our full efforts to this end. Moreover, considering the current aspects and factors, for the time being, we need to carry out regular vaccinations in the future, and this is highly likely going forward. And to this end, we will also speed up research and development of Korean vaccines as well. Thank you very much.
Right, there was Kwon Junuk with Thursday's afternoon briefing, and I have our Kwon Soa back here in the studio to tell us what he had to say. Right, Soa.
Yes, let's start with an analysis of preemptive testings at virus vulnerable locations in the past month. According to Kwon, some 2,050,000 tests were conducted at some 34 venues, and 37 people tested positive in that span. That seems to be not a high number, but there were also preemptive testings at specific regions or among specific groups that seem to be at high risk. And there, between February 26th and March 25th, in 13 provinces or cities, tests were conducted. 530,000 tests were conducted, with 449 infections resulting from that. So authorities will continuously try to find any loopholes and aim to detect these cases as fast as possible through these preemptive testings. And also Kwon stressed that before there's herd immunity among people aged 65 and above, which is the age group that's most vulnerable to COVID-19, social distancing and face mask wearing still has to be continued. So he mentioned that prevention measures based on voluntary cooperation by the nation's people is important.
Of course. Right, so thank you for that then.
Thank you.
코로나19는 연령이 높을수록 사망 위험이 커집니다. 어르신들께서 예방접종에 적극적으로 참여해 주시면 코로나19로 인한 사망률이 감소하고 중환자 발생도 줄어들 것입니다.
어르신들의 경우에 지금 이상 반응이 더 높다라는 근거는 없고, 예방할 수 있는 효과는 젊은 사람하고 비교해봐서 특별하게 떨어지지 않고.
Starting on this Thursday here in Korea, vaccinations are open to the greater public, with senior citizens aged 75 and above included. Having said that, in this studio session, we delve into matters related to COVID-19 inoculations for the elderly. I have Professor Sarah Ok-shin from Korea University. Welcome back, Professor Shin.
Thank you for having me.
And joining our talk virtually is Professor Michele Carbone at the University of Hawaii, who is currently in Nevada over in the US. Pleasure to have you with us again, Professor Carbone.
Very nice to see you again.
Right then, Professor Shin, about 86%, that is, of those aged 75 and above are willing to receive their COVID-19 vaccines. What are your thoughts on this finding?
Yeah, I think a vaccine acceptance rate is pretty high compared with other countries. So I think it's a very good thing and positive sign, since we want to achieve the herd immunity by November this year. So, and I think there are a few reasons why we have this high vaccine acceptance rate. So I think that our senior citizens have a very good understanding of how important it is to get the vaccination and to protect themselves, and not only protect themselves, but also to protect, their family and friends and neighbors. And it is also, our senior citizens have very good appreciations on, vaccination is the only way to get out of this COVID-19 pandemic. And it's the safe way to have this goal for us. And also, I think the elderly over 75 years old are getting Pfizer's vaccine rather than AstraZeneca vaccines. So I think that's probably one of the reasons why we have high vaccine acceptance rate, because there are more positive attitude or sense of trust towards Pfizer's vaccine, since less side effects have been reported with the Pfizer's vaccine than AstraZeneca vaccine. So I think that's probably why we have high vaccine acceptance rate.
Right. Meanwhile, Professor Carbone, I understand you've also been vaccinated against COVID-19. Do tell us a bit about your experience.
It was a very nice experience. I went in this place, there were a lot of people, mostly old people, but all ages. I got the Johnson & Johnson vaccine. The process took about 3 minutes in line, 1 minute for the shot. Then you sit in a chair, you wait 15 minutes to be sure that everything is fine, but everybody was fine. There was a physician who was walking around to be sure that everybody was fine. I talked to him and I asked him how people were doing, and he told me everybody was doing great, that he had no problems at all. He looked a little bored. And after 15 minutes, I went home. The only thing I had was pain at the site of injection that lasted 3-4 minutes, and that's it. As easy as it can get.
I see. That's good to know, Professor. Now, as I mentioned earlier, Korea is launching its second quarter inoculation with the focus on the greater public, including the elderly. Now, I have our Chun Song-cho out on location to give us a glimpse of the scenes at one public vaccination center. Hello, Song-cho.
Good afternoon, Sunny.
Right, Song-cho, what is the atmosphere there like?
Well, I must say it's almost like an assembly line at a factory, a very well-organized and systematic process involving people, lines and lines of people waiting in their lines and taking turns to roll up their sleeves and get the shots in their arms. I mean, I'm at a vaccination center in Jungnam-gu district, northeastern Seoul, and today the nation's second phase of immunization drive kicked off, which means the general public aged 75 or older have started getting the first doses of vaccine today. So it's no surprise that since 9 a.m. this morning, people have been bustling in and out of the center, what used to be an auditorium of the district office. So it really has to stay this busy for the quite foreseeable future if it means to pick up its vaccination pace and reach the goal of inoculating 170,000 people by the end of the third phase. And it also aims to inoculate around 280,000 people by November. That's about 70% of its residents, that magical ratio for that group immunity. And so why don't we interview one of the people here who've already gotten the vaccine. 어르신, 그러면은 오늘 이 백신 맞으면서 소감이 어떠셨어요?
모두 맞는 게 맞아야지. 그냥 안 맞으면 안 되니까 기분 좋게 맞아야지.
그래서 기분 좋으세요? 감사합니다. 네, 감사합니다. All right, so he said since it's inevitable to get the vaccine anyways, he got the shot with a very good heart, and he was very willing to get the vaccine. The center is also running transportation, providing transportation for people to increase its accessibility. So there are a total of 9 shuttle buses that are running between the center and other major stops, such as like the nearest subway station around the center. And what's also new today, what's starting new today, is the government's recommendation that will take effect today. It's for the employers to allow their workers to take sick leaves post-vaccination for any possible side effects. So that means you can take a day or 2 off from work without any reprimand, even if you don't have a doctor's note right after you get the vaccine. So the government, the authorities, and medical workers, everyone who's involved in this process are doing their best to make the process and experience of people getting vaccine as seamless and comfortable as possible. But yes, we are turning a corner in terms of this pandemic situation, but we also have to remember that we are not completely out of the woods yet. So remember, we need everyone's participation to reach that group immunity until November. And back to you, Sunny, in the studio.
All right, Song-cho, thank you very much for that coverage. And to our audience here, we do apologize for the disruption, the brief disruption in our audio connection with Song-cho. Right then, Professor Shin, what are your words of advice with regard to vaccinations for senior citizens with underlying health conditions?
Yeah, so it is well known that elderly citizens with underlying medical conditions are particularly vulnerable to severe COVID-19. And because of that reason, they are the top priority group who must get the vaccination. So before the vaccination, it is always good to have the best physical conditions If you have any fever or fatigue, then you should probably delay a couple of days until you recover to have best conditions. And if you are a elderly citizen with underlying medical conditions, you're probably taking prescription drugs every day. So it's not recommended to stop or postpone taking these drugs by the time you have COVID-19 vaccine. But if you're worried about taking these drugs while vaccination, you can ask your healthcare providers if your taking drugs would, sometimes these drugs could suppress the immune system. So you can ask your doctors about whether it is okay to take these drugs when you go to the vaccination.
Right. Meanwhile, Professor Carbone, tell us a bit about the precautions in the US with regard to COVID-19 inoculations for the elderly who have pre-existing health conditions.
There is no particular precautions that you have to take. The vaccine is safe. There is nothing to worry about taking the vaccine. And the only thing that people who are 75 and older should worry is not the vaccine, is to get the virus. Because 80% or so of people who die of COVID are people with pre-existing condition who are older people. So if you get infected with SARS-CoV-2, the danger is if you have pre-existing condition, if you're old. The vaccine is going to take away that problem. Therefore, there is really nothing to worry about. Just take the vaccine, because the vaccine is no danger. The virus, for somebody who has pre-existing condition, who is old, is a serious problem.
I see. Meanwhile, Professor Carbone, what have been then some of the more common, perhaps, post-inoculation discomforts among the elderly vaccine recipients in the US?
What has been done about what?
About the common post-inoculation side effects reported among the elderly in the US.
They are the same. You have pain in the arm, which is nothing. I mean, I had it. Last 3-5 minutes, that's it. And then there is a group of people who has I would say, like if you have an influenza, you feel tired, you have chills, you get fever. It can last 2 or 3 days. Usually that happens after the second injection. If you take the Johnson & Johnson, it's just one, and so that's easy. If you are with the RNA vaccine, at the second injection, that's what happens. In the USA, they've done nothing. In another country, in Italy, for example, they give only one shot to those who have been infected before, because it appears that the reaction is stronger in people who have already been infected. So after the first shot of vaccination, the people who have been already infected have the same amount of antibodies against COVID than people who get 2 infections. So to make it simple, would be like giving 3 injections to somebody who has not been infected. And for that reason, to decrease the side effects, and also to save virus, to save vials of vaccine, in Italy now give only 1 shot of the RNA vaccine to people who have been infected before. And since, unfortunately, in Italy there have been many people infected, that saved a lot of doses. But even if you get 2 days of fever and you feel a little bit sick, come on, it's nothing compared to the risk that you have if you are 75-year-old, obese, with diabetes, you get infected by the virus, it's a serious problem. If you are 20-year-old, you have nothing to worry about.
Right. Professor Shin, then, what are some of the symptoms that the elderly need to be wary of after inoculation?
Yeah, so as Dr. Carbone has mentioned, the most common side effects are, the swelling or pain at the injection sites. And usually some people complain of a little bit of mild fever, fatigue, or muscle ache. But these symptoms usually, go away naturally. And if you have a mild fever, you can take, acetaminophen-based drugs like Tylenol for a day or 2. But if fever, sometimes persists in some people, and If it lasts for more than 2 days, then you can maybe visit the hospital to see if there are any other reasons for that. And if you have any severe allergic reactions like anaphylaxis right after the vaccination, then you definitely need to have immediate medical attention by calling 119.
Right. Professor Carboni, I hear the quality of sleep affects the production of antibodies. Now, what can you tell us, Professor Carboni, about the relationship between sleep and our immune system?
It has been known for many years that if you are stressed and you do not sleep, you have problem with the immune system. Often you have autoimmune disease. So when you do not sleep, you are more likely to get stressed. And when you are stressed, you are more likely not to sleep. So the two things work together. Therefore, these people may have some basic problem with the immune system, but it's not a night of sleep before taking the vaccine that is going to improve the COVID-19 vaccine efficacy, okay? I mean, to think that you sleep 8 hours rather than 6 and the vaccine works better, it's pretty naive. The issue, if you have to worry about something, is not the person who received the vaccine. The issue is the agencies that in your country are handling the vaccines to be sure that these vaccines are kept frozen all the time. Because the Pfizer vaccine, the Moderna vaccine, the RNA vaccines, unless they are kept at -80 from the time that they leave the company, the factory, to almost the time that they are injected in the arm, they are completely degraded. So the only problem that I could see in the efficacy of the vaccine is not how much the guy slept the night before, is the vial of vaccine being kept the way it should have been kept. Because during time it's possible that if something goes wrong, that the vial has been ruined. So it's very important that the agencies who handle the vaccination in your country are very careful to maintain the cold chain so that the vial is fully effective. And as long as the vial is fully effective, where you select 5 hours or 8 hours, the vial is going to work.
Right, Professor Carboni, a very valid point, of course. Now, Professor Shin, also starting this month is the so-called Vaccine Holiday Initiative, in which the government is strongly recommending people to be allowed to have a day or two of rest to address their post-inoculation conditions. What are your thoughts on this effort?
Yeah, so I have heard that, young people, usually young people who have taken AstraZeneca vaccines have complained of a mild fever or muscle ache or fatigue right after vaccination. And that's very unfortunate. And, having these uncomfortable feelings after vaccination could put a burden on these people to return to their work or daily life. And this could potentially raise the risk of, avoiding the vaccination. So I think, employers need to find a way to, give the day off after vaccination. And I think the government should be able to give financial support so that, these time off after vaccination could be mandatory.
Right. And Professor Carboni, I believe there are similar initiatives in the US to offer people who have been inoculated a day or two of rest, or maybe 4 hours of rest in the case of New York, to allow them to address their discomforts. What are your thoughts on this?
Look, America is 50 states, and each state has its own rules. But in general, everybody wants people to get vaccinated. So I can't imagine anybody getting on the case of someone who say, I got the vaccine, I'm not feeling well, I want to stay home. I had several people who work for me who told me that. I say, stay home until you feel better. After a day or two, they were all back to work. We all want people to get vaccinated. So I think any company, any agency will facilitate their employees to get vaccinated. We all want them to be in good health, so please.
Right. Meanwhile, Professor Shin, there have been reports of COVID-19 infection post-inoculation. What are some precautions to follow to avoid such a scenario?
Yeah, so usually, we have to get 2 shots of vaccines with AstraZeneca or Pfizer, doesn't matter. And so it'll take time to develop immunity. And, people should remember that the antibodies will form after 2 weeks of vaccination. So you still have to abide by the quarantine measures. You have to avoid, crowded places, and you have to do social distancing as well as washing hands and, all the things that you have been doing so far.
Right. All right, Professor Shin, as always, thank you very much for your insights. And Professor Carbone over in the US, thank you very much for your blunt and reassuring words about the vaccination.
Sure.
Right then, health experts say one possible way of escaping concerns of COVID-19 infection at the moment is vaccination. So do seek to effectively protect yourself from the pandemic. Thank you for watching.